welcome back. My next guest is Craig O'Neill, who is, let me see if I get this right, Chief Clinical Officer with Results Physiotherapy.
That is correct.
All right, now I started the show with talking about back pain, slip disc, instability, malalignment. Are any of those words important, or what is it when we talk about low back pain?
Yeah, that's a great question. So, low back pain is some pretty common thing that many people suffer from. But those words that you bring up, like instability or slip disc, they're pretty incorrect statements. And for example, the lumbar disc doesn't slip. As a matter of fact, it's very stable, and it's very hard to make it move, even when we dissect lumbar spines. And the term instability, drives a lot of fear in people. And we as physical therapists use that term on a pretty regular basis. But if I told you your house was unstable, would you spend the night in it?
No, well, that's true. That's true.
So we look at things like that drive fear in patients, and trying to really help them understand how to approach and look at their back pain in a different manner.
Now, we talked a little bit about off air about threatening or worrisome things that people do when they hear back pain problems.
Yeah, that's probably one of the things that has changed the most in the care for patients with back pain, is really understanding what the beliefs are around it, and then how do we address that as clinicians. And a good example of that might be, if I have back pain, well, I really better sit with good posture. Well, that's not always true, particularly with the persistent low back pain patient, because the overactivation of good posture can drive the pain process quite a lot. And so there is no good or bad posture, but there are positions that we sustain for way too long. Our bodies are made to move, and our bodies love a variety of positions.
Well, now you kind of mentioned that, and I've been doing this a while, so I learned a long time ago different things with anti-inflammatories and muscle relaxers and moist heat. But things have come a long way and maybe a little different. There's different ways to treat low back pain. You mentioned posture being one, but what other things are out there?
Yeah, really, probably what's changed the most is, still using some of those things as needed just to help with reduce an acute bout of pain. But really, particularly the patients with persistent or chronic low back pain, it's helping patients understand they should trust their bodies, that having pain does not necessarily mean damage. As a matter of fact, particularly folks that have had pain for a long time, the pain's not associated with damage. But it is associated with changes within their nervous system. So it doesn't mean they don't hurt, because they absolutely do, but it's not driven from a tissue cause such as a joint or a muscle or a disc, like it might be when it's an early injury.
And they can get better.
Absolutely. And that's an interesting question, because persistent pain patients or chronic pain patients have a tough time reducing their pain overall, but what they can do is return to a lifestyle that they want to. So they can be active. Matter of fact, they should be active. It's probably the #1 treatment for persistent back pain is some level of activity. And that's where physical therapists really play a big role in helping patients get back to living a life that's meaningful to them.
So tell me about that. Somebody comes to see you. Tell me some things that you actually do for the patient.
Yeah, absolutely. So if they came in to see us, we do a thorough examination, understand what that pain means to that particular person. How is it affecting their life? What are the things that they want to do that they have stopped doing or are afraid to do, and begin to address a plan around that. Now, in that, as physical therapists and manual therapists, we provide a number of different options of treatment, some of which are passive interventions like deep tissue massage or mobilization and manipulation. But then probably the key thing is really helping the patient have a great understanding of what's going on with them, and then developing a plan to sort of get them into a graded plan back into the activities that they want to do. So that might start with very basic exercises, very easy things as they learn to trust and move a little bit better, but then making sure that we move them all the way to the end of getting back to literally testing and trying and working into the activities that they've been afraid of doing for a long time.
Well, that brings a question in mind that maybe you can't answer. Is there an average length of treatment? I mean, is this a one-time deal or a 10-time deal, or is it individualized?
Yeah, that's a great question. So it is always individualized. Good physical therapy is always unique to the person in front of you that you're caring for. And that program really looks at anywhere, so it's less about a number of visits, but an average number of visits would be 10 to 12 visits. And that may be distributed over a month, it might be distributed over 3 months, depending on what that particular patient needs.
And what you do, you treat them at the time, but you teach them long term how to take care of their back.
Absolutely. That's, yeah, it's a disservice if we don't give the patients the tools how to self-manage, how to deal with things if they have a quote flare up, help them understand what's going on so they have the tools that they can manage long term.
Are there myths or beliefs that are different about low back pain that we used to think of? I mean, you mentioned one, posture. Are there some other ones?
Yeah, one of these, and this may come as a surprise to a lot of people, is the whole idea around core stability. And so this has been a big thing that, if we have people have good core, they'll have no back pain. And it's a complete myth, and the literature and research has debunked that over and over and over. As a matter of fact, in patients, again, with persistent pain, they're found to have overactivation of the core muscles by upwards of 100% in their stomach muscles and back muscles. So we find ourselves actually teaching people to turn those muscles off now, but ultimately they have to get into a strengthening, conditioning, and movement program that works for them. And so it doesn't mean that you can just be inactive and your back pain is going to go away. It means that we have to approach it a bit differently around some of the beliefs.
And you did mention it's not, you don't want to be inactive. Actually, being active helps long term.
That's right. If I could have any back pain patient, whether it's acute or persistent, or do one thing for their back, it would be go walk for 30 minutes a day, even if you have pain doing it. Because what you'll find is that begins to do many of the things that the lumbar spine really likes: movement, exercise, activity, variety of positions, all of those things.
Well, that's great information. Thanks for coming in for Back Pain Results Physiotherapy.
Thank you very much.